Alright, good morning. I'm going to do an Ezpap. So the first thing I'm going to do is check the patient's chart, and then I will knock on the door to the patient's room and introduce myself. And before I begin, I always check the patient's ID band, wash my hands, and then I'll assess the patient before I do a treatment. So I'll listen to the patient's lungs, and then I will get their vital signs down before I do the treatment. So here we have an Ezpap. And so here we have two different ports, and so if I need to measure to see how well their sorority rate is and everything, I have a disposable manometer, and so I connect it to the port here, make sure it's on there tight, and then the Ezpap has to be connected to an oxygen source to be able to work properly. So here I have the tubing for the oxygen source here, and we will connected to it, and then I'll demonstrate for the patient. And so here we have the Ezpap. So this Ezpap is to help you clear out your lungs, open them up, help prevent any excess fluid in your lungs, and to prevent any atelectasis or anything to a collapsing of your lungs for being bedridden and everything. So I'm going to connect it to the O2 source. We'll turn it up to 5 liters per minute. I'll instruct the patient to hold it like this, not to cover the endpiece, as it won't get the appropriate flow, oxygen flow through with their breathing. So don't want them to hold it like this, because then you won't get the appropriate reading. So you'll have them hold it like this. And then you'll have a mouthpiece on the end of here, or if they can't do it with the mouthpiece, you can have a mask. But with the mouthpiece, you instruct them to have a tight seal with their tongue underneath the mouthpiece. Have them take a nice deep breath in and exhale. So you'll have them do that a few times, and then after every treatment, you always have them take a nice deep cough. And if you have any sputum, any samples, you can have them cough them up into a basin, or if you need to take it to the lab, you can put it into a sample cup for the lab. So when you are done with this, if they need a nebulizer treatment with this, you can have another mouthpiece, a T-piece there, and then it'll have a little medicine cup at the bottom here for their nebulizer treatment to work. And so when you're done, you dispose of the manometer. So if you don't need this, you dispose of that, and then you always cover the port so that way you don't have any excess air coming through the port. That way they get the appropriate treatment when they're doing it. So when you're done completely with this, you would shut it off, remove it from your oxygen source, remove it from your device. So instruct the patient not to put this in water or anything to clean it. It just needs to be air dry. So you would set it somewhere to air dry it, and then you would set this aside so that way you can use it again when you need it. So you set it there off to the side, and then you would reassess the patient. Always wash your hands before you do anything else after treatment, and then you would listen to the lungs, check the vital signs, and then chart down if they have coughed up anything, and let the doctor know that you had done a treatment with them.